Hello, good day to you all, and welcome to my channel. And today I'm going to be talking about your CQC. I just really feel that it's something that is really important for people the registered managers as well as providers to really be aware of. And I'm super excited to be sharing this with you today. So I really want you to be able to focus on these key areas of being well prepared for care providers so that you can effectively demonstrate that your commitment to high quality care during your CQC inspection. Okay, so I'm going to dive into it now. Okay, so safeguarding protocols is what you need to be thinking about, the guidelines for a home care agency. And I'm referring to in the UK. I'm going to be doing a video on the USA, but this is for the UK. Now, safeguarding protocols and guidelines for a home care agency. So the policies that you need to think about is safeguarding policy, which is maintaining a comprehensive safeguarding policy, outlining your procedures to protect clients from abuse and neglect. Now, it's important that you have in that safeguarding policy what actions need to be taken. Who is it that you need to talk to regarding a safeguarding issue? Then you need to speak with your local safeguarding team in the locality of where you wish to operate. They will have a protocol of what you're meant to do and who you're meant to notify them, what their email, telephone number, address, etc. And yes, of course, it depends on the level of safeguarding. The ultimate thing is if it's urgent, then it's 999, for example, the police. Okay, I just wanted to point that out because we must ensure that the safeguarding policy does state all the different actions that you will take. The second thing that you need to think about is your staff training. So ensure that your staff receive regular training on safeguarding, including recognizing the signs of safeguarding and the correct reporting procedure. Nothing worse than a staff member being out in the field, for example, by themselves, going into a service user's home, and they feel that there's possibly a safeguarding concern, that they must be told what are the best steps, how do they approach, and who do they report to immediately. Obviously it's the registered manager, but also if it is immediate, then it could be, the police, for example, or it could be a relative, for example. So who is doing the safeguarding? For example, who is it that the service user is telling you that they feel that they could be an issue, or that you've spotted yourself, for example? So you have to be discreet and only tell the people that really need to know immediately. Okay, so this includes recognizing signs of abuse and correct reporting procedures. Risk assessments is what you need to be able to describe in your inspection with the Care Quality Commission, for example. So your initial and ongoing assessments conduct through risk assessments for each client during initial intake and regular thereafter. So you ensure that you have your documentation, you keep detailed records of all risk assessments and any action that needs to be taken to mitigate any identified risk. Now, another thing that you need to be able to discuss is reporting and response. So clear reporting channels, ensure that you have a clear and accessible channel for all reporting concerns, including the designated safeguarding lead. So who is the designated safeguarding lead? Then you got to think about immediate action. Ensure that any safeguarding concerns are acted upon immediately following the local safeguarding procedures, protocols, and notifying the relevant body like social services, adult safeguarding team, if it is an adult, you've just got to make sure that you have all the proper things in place. So when it comes to client and family engagement, information sharing, provide clients and their families with information on safeguarding and how to report any concerns that they also feel that they've seen, for example, and that there could be an issue. So have feedback mechanisms whereby you're able to implement regular feedback sessions to identify and address any potential safeguarding issues. So you've got your your handovers, you've also got your care plans, you've also got your reporting communications book, for example, just making sure that you've got clear feedback mechanisms, for example. Even in your software, you're GDPR compliant, you've got your ICO certificate, you are a controller, for example, of information. So you need to make sure that it is safe and it's only shown to those that need to see the issues that are arising or have arisen. So continuous improvement, you want to ensure that you do audits and reviews. So regular audits, safeguarding practices and review policies to ensure that they remain effective and up to date. So just think about these things. So the next thing I'm going to talk about is learning from incidents. Conduct thorough investigation of any incidents and implement lessons learned to prevent further occurrences. Things that you need to think about, key points to highlight to the CQC inspector is your training records. Provide evidence of staff training in safeguarding. There's also your policy documentation. Show the safeguarding policy and any updates that you make. Make sure that the dates are in date as well. Now, incident reports. You want to present reports that are recorded and reported incidents and actions taken. There needs to be a flow chart of how this happens, and do a lot of flow charts that will help your staff members as well to be able to quickly identify what to do step by step. Risk assessment, documentation. You want to share examples of completed risk assessments and follow-up actions. Now, if you haven't got a client, then you'll have some examples, which will be just as good as when you're being interviewed for the first time in your inspection. So feedback and audits. You want to demonstrate how feedback is gathered and used to improve safeguarding practices and ensure that you present recent audit reports. Another thing you need to think about is the fundamental standards for home care providers. Person-centered care, respect and dignity, treat clients with respect and dignity at all times. Number 2, consent, obtain and record information, consent for all care and support provided. Number 3, individualized care. So tailor care to meet the individual's needs and preferences of each client. Safety, safe care and treatment. Ensure that the care is delivered safely with appropriate risk assessments and measures in place. So safeguarding, you want to protect clients from abuse and improper treatment through robust safeguarding policies and procedures which you have. Cleanliness and infection control. You want to maintain high standards of cleanliness and infection control. Staffing. You want to ensure that you've got sufficient staffing, ensure that appropriate levels to meet the needs of the client. So you've got to make sure that you've got staff members as backup, just in case that staff member goes off sick. You know what the availability is of the staff members that said that they will be available to cover any absenteeism. So you've got that on a regular basis. You literally have to do this every week to make sure that you've got backup. The next thing that you need to think about is staff competencies. You want to provide ongoing training and support to ensure staff are competent and confident in their roles. Governance and accountability. Leadership and management. You must maintain clear leadership and governance structures. Quality assurance. Regular reviews and audit care practices to ensure that they are met with high standards. Complaints handling. Have a clear, accessible procedure for handling complaints and feedback as well. Legal compliance. Regulatory compliance. You want to stay informed about any compliance with relevant health and social care legislations, including the Health and Social Care Act 2008 and Care Act 2014. There is Health Watch, which is an independent national body in England. They're champions and they're really good for you to get some more information regarding social care service users. It aims to ensure that people's experiences and concerns shape the quality and delivery of these services that you provide. So check out Health Watch. It gathers feedback from the public about their experiences and it provides information and advice like the Care Quality Commission. This drives improvement in health and social care services based on the service users' needs. There's more reading here as well, which is Health and Social Care Act, Regulated Activities, Regulations 2014, Reg 5, and this is fit and proper persons directors, for example. There's a link here in the description. I'll hopefully try and cover all of it if it lets me. However, I will be going through some trainings individually. So Health and Social Care Act 2008 is a regulated activity, which is Regulations 2014. Regulation 7, which refers to the registered manager, should demonstrate that they have the appropriate knowledge and applicable legislation, including the Health and Social Care Act 2008, Regulated Activity, Regulations 2014, Part 3. So relevant best practice and guidelines and understand the consequences of failing to take action. And we need to ensure that we have this set as requirements. So regulations for service providers and managers related to, which is a link here. What we want to ensure is that we have the correct information here. There's the link here, which is regulation for service providers and managers, regulated guidance. So regulations for service providers and managers, related categories, which is organizations that the CQC regulate. There is a page set out further information and guidance related to the Health and Social Care Act 2008, Regulation Activity, Regulation 2014, and Care Quality Commission, Regulation 2009. The contents are here, which is Regulation 4, requirements where service providers is an individual or a partnership. Regulation 5, fit and proper persons directors. Regulation 6, requirements where the service user, service provider is a body other than a partnership. Regs 7, requirements relating to the registered manager. Regulation 8 is general, for example, but there's still a lot of information in here. So Regulation 9, person-centered care. Regulation 10, dignity and respect. Regulation 11, which is need for consent. Regulation 12, safe care and treatment. Regulation 13, safeguarding service users from abuse and improper treatment. Regulation 14, meeting nutritional and hydrational needs. Regulation 15, premises and equipments, if it applies. Also, Regulation 16, receiving and acting on complaints. Regulation 17 is good governance. Regulation 18 is for you to understand about your staffing needs and meeting the needs for the regulation. Regulation 19, fit and proper person employed. Got to make sure that the staff members are fit and that they are able to do the job effectively and qualified and competent to do so, as well as safe to minimize any risk for service users or patients. Regulation 20, duty of condor. Regulation 20A, which is requirement as display of performance assessment, CQC, registration regulation related to guidance. So please have a look at this. There's a link here as well. The manager evidence of the relevant qualifications, training, and completed within the last 2 years. This can be presented by using a training matrix. You got to make sure that you understand about governance, access to people's homes, and training metrics as well, which you'll need to discuss the training that staff will have, and it will be like a folder for you to have as an example during your registration inspection, should I say. So there's a link here for the scope of registration if you want to have further details, but I just wanted to touch base with you about if you're looking at registering with the Care Quality Commission, going through inspection with them, some of the things that you need to have in order to really be prepared, really to understand what it is that you need to say and do as the registered manager, and to provide the evidence so that the Care Quality Commission can pass you during your CQC registration. So I hope that you found that helpful. Do like and subscribe. There's further training here, which I'm going to be doing quite a lot of. I'm going to be doing a lot of video trainings as well as podcasts as well. So I hope that you've enjoyed today. If you have, if you could just do me a favor, like and subscribe, share the video. If you feel someone will benefit from this, let them see it, because I know a lot of you are possibly going through registration with the Care Quality Commission, and you're possibly feeling very nervous right now and feeling very frightened, and whether you're going to forget your words, etc. But if you study for it and go onto their website and look and read and listen to this video, and then point out the key things that you need to do, and get a notepad and paper and write it out, highlight it, and then you're going to be ready. You'll be good to go. So I wish you all the best with your CQC registration, and let me know how you get on. Put a link in the chat here, whether this was helpful to you. I'd love to hear your comments. I just can't wait to help you to grow your healthcare, home care business in the UK. And I look forward to speaking with you all soon. Thank you so much. And I hope that you've enjoyed this training today. God bless. Thank you. Goodbye.